Hey, Chris Cosby, CEO of Poinciana Medical Center. I just want to touch base with the community and first of all say thank you. Your support during this COVID crisis was very generous and we just want to say thank you. Second, we put several things in place to make sure that you stayed safe, our staff stayed safe, and our physicians stayed safe during this crisis. And we came out of this very strong. Third, we're ready. We're ready to take the next step in opening this hospital. The big part of that is doing outpatient procedures. Next, Dr. Karen is going to give you a big walkthrough on how this process will go when you come to the hospital.
Hello there, and welcome to Poinciana Medical Center. I'm Owen Kieran, the Chief of Surgery at the hospital. See, I am wearing a mask, and normally I would continue to wear this mask throughout my day. But for the sake of this video, I am going to take it off. Give me 1 second, please. We're here today making this video to help assure you, our patients, and those we care about, that we're doing everything we can to protect you, your loved ones, and our hospital staff. So as you enter our hospital, the first person you're going to meet is our screening personnel. Here, our personnel will take your temperature.
97.2.
Thank you, Nisha. You'll be handed a mask, and you'll be asked a series of questions to screen out whether or not you may have been exposed to a COVID-19 or someone who may have had it. After your screening is done, we'll proceed into the main lobby of our hospital. This is our main lobby. As you can see, we take great pride in keeping our facility clean and in good repair. We've spread out all our furniture so that we can maximize the social distancing. Everything you see is deep cleaned at least once a day, more frequently as needed. And anything a patient may touch, any of our equipment, is also sanitized both before and after every patient use. Here's where you would meet the next member of our surgical team, the pre-admission testing nurse. From here, we'll proceed down the hallway. Our OR suite, this is where you'll go for your pre-admission testing about 2 to 3 days before surgery. And also this is where you'll return on the day of surgery. So let's go back and take a look. Everything you see again is cleaned multiple times a day, and every patient area is also sterilized again before and after every patient use. Here's our typical pre-admission testing room, nice and spacious. This is where you would meet with our pre-admission testing nurse. Pre-admission testing is a standard part of all scheduled procedures. This is where the nurse will confirm that your surgery, confirm that you don't have any additional questions that may need to be answered. And also this is where we would do your routine blood work, maybe an EKG, chest x-ray as well. As an additional safety for you and for our staff, and most importantly all our other patients, we are also testing all of our patients with scheduled procedures for COVID-19. After your testing is performed here, you'll be escorted back out by our nurse, back out towards our lobby where we came in originally. Back. So today would be the day of your surgery. Again, we're standing in our lobby right in front of our operative suite. And now we're going to go back in, and for the next part of your journey, you're going to see the preoperative area, and we'll go through what you could expect on the day of your surgery. Here's a typical patient preoperative room. Again, quite spacious, quite comfortable. While you're waiting, there's a TV. And this is where you meet the next members of your surgical team. In here, you'll be met by our preoperative nurse. They'll help you get ready for your surgery, help you change into the appropriate outfits. Again, if you don't have a mask at this point, you'd get a separate mask. And here's also where you meet the remainder of our surgical team. You'll meet our circulating staff for helping out in the operating room. You also meet the anesthesiologist, and they will go through the whole anesthesia process and what you can expect from that. And again, here's also where I or one of the other surgeons would meet you to answer any last minute questions and to go over what you can expect, again, as a post-operative patient. All right, so here we are at our OR. We're gonna go take a walk through. And as you can see, as we're walking in, our staff and our employees take great pride in how clean we keep everything. Every day, the OR is completely clean from wall to wall, every single room. and it's sterilized every day as well. I'll take you inside one of our ORs. As you can see, again, everything we take great pride, nice and clean, everything's very modern. Every day between patients, we are sterilizing all the equipment, all the rooms, and then at the end of the days, we're doing what's called a deep cleaning, where we put an even extra amount of sterilization in to really keep it clean, keep it safe for you and for us as the staff of the hospital. Okay, let's go back this way to the recovery room. You would be recovering in a bay like this. The nurses here would be taking care of you, making sure your pain's addressed, making sure that you've recovered from your anesthesia. And here's also where, when you're ready to go, we'll call out to your significant other or your responsible adult who's going to be taking you home.
Thank you, Dr. Karen. As you can see, we're ready for you. We're always going to be ready for you. We're always going to be here for you. Because at Poinciana Medical Center, above all else, we're committed to the care and improvement of human life. Thank you for your support.